Hey everyone, I hope you found great value in my videos so far, and this video is getting into what are the 5 exercises that can be performed in a seated position to improve your leg strength, your balance, and to decrease your fall risk. Yes, in my practice I commonly use this program as a way to get things started with working with balance because they're pretty easy to do and there's no chance of falling, and someone can do them independently, giving them the power of the rehabilitation in their own hands. They don't require any equipment, and they can be done almost anywhere. I hope you find great value in the video, and be sure to hit the subscribe button. So the first exercise today is what I refer to as heels and toes. Fairly easy to do, so I'd recommend a high repetition count, 20 to 30 repetitions, depending on how it feels for you. Now what the purpose of this exercise is greater push off when you walk through greater plantar flexion or the heels up, and then greater clearance of the ground, less shuffling. So from the toes up, it's called the dorsiflexion. So plantar flexion, dorsiflexion, greater push off, greater foot clearance, greater push off, less shuffling when you walk. So it's an important exercise, even though it's pretty easy to do and pretty basic. So heels and toes. Just rocking back and forth. Trying to get the highest lift you can. If there's pain, I would stop short of the pain. Meaning that if you're moving through and you're fine pain, just stop short of that just a little bit. Over time, you should be able to gain more pain-free range of motion as you continue to work through the program. The second exercise is what I refer to as kicks. But when you do a kick, the key is to keep the hands on the thighs. Yes, if the hands are on the thighs and you can feel the muscle firming up as you kick side to side, it's called tactile facilitation. And by having the hands on, there's extra sensory input that's sent to the brain, and you will actually strengthen these muscles faster. Why that's important is that your quadriceps or your thighs are actually very important muscles to our overall daily movement in life. So strengthening this muscle will really help improve your quality of life. And by keeping the hands on the thighs, especially if you can feel the firming up, you will get more value. Again, called tactile facilitation. So again, 20, 30 reps. Pretty easy movement to do. Next up is what I refer to as a seated march. So you place your hands by your side if you like, that's how I like to do it, and you raise one knee at a time. This is to strengthen your hips and a bit of your core. A lot of our movement and the best way to address back pain is through core strengthening. So if back pain's an issue, this one will be helpful in that way. But I mainly teach it for strengthening. When we advance our limb or take a step with our leg, we have to use the hip flexor to bring it forward. So it's another important muscle group for walking. Number 4 is what I refer to as hip out and in. Now there's a lot of different ways you can do what's called hip abduction or a seated clamshell. But what you can often start with, that I start with in my practice, is just shifting back and forth, kind of sliding on the ground like I'm doing now. So this is to strengthen the outside of your hips called your glute medius, which can protect your knee and also help with overall movement and balance. As you progress and get stronger, what you can do is have a lift and touch, lift and back, lift and touch, lift and back to bring in a bit more of the trunk, a bit more of the core. Now, if the march and the hip in and outs are feeling a bit easy, what you can do is add some resistance to get a lot more value from the exercise, which I highly recommend if you can. So a TheraBand is a great tool for that. And to use that, you just want to tie it around your legs. If you have body hair like I do, you might want to wear some sweatpants. It's not going to mess with your hair as much that way. It'll be a lot more comfortable. But then moving out and back. Okay, just straight out to the side and back. Using the resistance, you will get a lot more value from it because it's like lifting weights compared to just lifting your arms or your legs against gravity. Resistance training will give you a lot more value and a lot more gains in your strength at a faster rate. So if you can use a band, I'd use a band. Now you can also use that band for the seated march as previously discussed. So adding a bit more value to your hip and core strengthening for the use of a TheraBand. Now if you're using a band and it's kind of cutting into your legs, what I recommend to do is open it up a bit so there's a broader surface contact area. It's going to be much more comfortable that way and won't dig into your legs as much. So, and you can kind of hold it in place as you come out and back. All right, and the final exercise involves what I call a pillow squeeze. So far we've strengthened the front and the back of the lower leg, the quadricep, the hip flexor, the hip abductor, and to train the inner thighs, or what's called the hip adductors, you want to squeeze a pillow isometrically. So that just means holding for 5 seconds, and then holding with your hands to allow the blood flow to go back to your legs for about 2-3 seconds. Squeeze again, hands wherever you like, and then relax out. Now the pillow squeeze is different than the rest. I'd recommend 5 sets of 5-second holds with a moderate intensity hold. Where everything else, again, I'd recommend the 20 to 30 repetitions, 2 cycles twice a day. 2 cycles means you're rotating through the exercises, the 5 of them, and when you get through the 5, you double back to work through a second time. That's what I recommend in my practice, and I've had great results with that type of strengthening process. So again, 20 to 30 reps, 2 cycles twice a day, except for the pillow squeeze, which is 5 sets of 5-second holds. Now, always following the pain rules, no pain past 5 out of 10, and no pain lingering longer than about a minute or 2 when you stop the exercise, if you do have any pain. But hopefully these exercises are at the level where they can be pain-free. So this video has been all about what are the 5 exercises that can be performed in a seated position to improve your leg strength, your balance, and to decrease your fall risk. But there are so many different topics I could post about. It all just depends on what you guys would like to see. So please post your comments below and subscribe so I can do my best to create a meaningful video for you or a loved one to improve your life. This is Dr. John Mayo, physical therapist, really hoping that this program is helpful for you or a loved one and improves your life.